Good morning. It is Friday morning, an unusual time for me to hop on here and share with you all. But today my family's going camping. So I'm joining you before we head out the door, and I'm really excited to talk to you today because we had one of the best talks that we've had in our community, our Brain Bites community, last night. And it was with the amazing Janine Holmberg, who is a neuro PT in Utah and a leader in the field of dizziness and in particular 3PD. And she's one of my um, idols, to be honest. She's somebody I've learned a lot from, who our profession has learned a lot from. And we were so excited to have her as a part of our Brain Bites group. And she did a really great presentation. And then we were able to ask her all of our questions. So I'm so excited to share with you some of what we learned last night. And by the way, if you haven't met me, my name is Julie Hirschberg. I am the owner, founder of Re+active Therapy and Wellness in the Los Angeles area, and just really dedicated to learning and understanding more about the brain and our bodies and our emotions and all of those things coming together to bring people with neurologic disorders recovery from their disorder. And excuse me, I have been hanging out very deep in the literature of dizziness this week for sure, especially with Janine Holmberg joining us in our Brain Bites group last night. Also in functional neurologic disorders. And there's a big reason for both of those. One is we have a lot of people currently enrolled in our functional neurologic disorders intensive program, which is a 4-week program that we do at Re+active. It's been awesome to work with people intensely with this disorder and see just tremendous recovery. So this is a topic, as you know, I'm really passionate about. So I like to read a lot. I like to learn a lot. And dizziness is right up with that topic. I've been preparing for a course that we are teaching in October. We have a weekend course called Cultivating Central Nervous System Connectivity. And that's the topic I want to talk about today, particularly with dizziness, because we have another course coming up called A Positive Spin on Dizziness, and that's coming up at the end of this month. So August 28th. It's a 1-day course. I've been doing a lot of reading there and been able to hear from our amazing instructors, Catherine and Jamie, too, as they prepare, and been thinking a lot about this idea of really promoting neuroplasticity and positive nervous system connections in the brain when somebody has dizziness. So, by the way, if you're not familiar with this idea of cultivating central nervous system connectivity, you should definitely check out our Instagram live from earlier this week, where I actually shared the figure. It's a figure with plants and people and an analogy for nervous system optimization, really, and how we actually go through to promote those positive connections. So you can check that out. By the way, join our newsletter for our education. And every Friday, we send out all of our videos from the week and articles and resources. So we'll send that your way today. It's Friday. So you can join our newsletter. Which is just reactiveeducation.com/newsletter, and you'll get that in your inbox every week. But today I really want to talk about that cultivating central nervous system connectivity for dizziness. So we talk about this in functional neurologic disorders. We really could talk about this in neuroplasticity in general, but I want to talk about it in dizziness. I work with a lot of people who are dizzy for many different reasons. We see it a lot as part of post-concussion symptoms in our clinic. We see it a lot with FND. We see it a lot with migraine. And this analogy, our plants and people analogy, is so applicable. So today we're going to talk about what do we need in these different components of this plant analogy for dizziness. So what do we look at for our compost and our soil for the brain and dizziness? And you'll see what I'm talking about. What's the right amount of watering? So how much input do we give to help with dizziness? What about the environment and the weather? And finally, what kind of brain connections need pruning in dizziness? So let me give you a brief intro to this analogy. One of the favorite things, I wish I was at the clinic because I'd show you. On our wall, there's this really big, um, it's like a vinyl lettering on the wall. It says, "Hello brain, hello body." It's actually one of our therapists, Ali Elder, actually had this idea, and it was just brilliant. But it was like the brain and the body talking to each other and saying hello, right? And sometimes we can really feel like there's a disconnect. And what I like to think about for therapy is remaking the connections and relearning. So when we talk about this central nervous system connectivity, we're talking about all those connections. And oftentimes we need to really rewire them. And that is very possible to do. And it's helpful to have the right makeup to do that. So, meaning in our plant analogy, the right soil, the right compost, the right weather and environment, the right water, so the right sensory input coming in, and the right pruning. So disconnecting some connections that have gone awry and reconnecting other things. And this is where I think the plant analogy is so lovely. So let's talk about those components in dizziness, the compost and the soil. What does that mean in dizziness? What does that mean for our brain? So if we think of the soil first, I think of these things that optimize neuroplasticity. I've talked about these before, like sleep, systemic health, your nutrition, your fitness. And then when I think of the compost, I think of these as some of those underlying issues and ensuring that those are actually resolved. So a big example in dizziness is your neck. So a lot of people with dizziness, especially if they've had it a long time, will end up with some stiffness in their neck. Maybe they're not moving as much. Maybe they're in a lot of pain. And this actually, many people don't realize this. Um, uh, that can contribute directly to their dizziness. So when I think of pouring compost on the soil, I am going to assess and address the neck component of dizziness. So if they have a cervicogenic dizziness component, we're going to address it. That's like putting compost on the brain soil. So if you can imagine, your brain is aligned to provide a stable environment for you to move in. And if you're feeling off balance and dizzy, you're not having that stable environment, right? So you might need some compost in your brain, and that compost might be providing the correct sensory input from your neck to your brain to tell your head where it is in space. So that's how I use the analogy, by the way. This analogy is great too for the person that totally gets gardening. So we'll talk about this, like we need these ingredients, right? We need these pieces of compost. And one of them might be the neck. Another thing that Janine talked about last night when we were talking about 3PD is also how challenging it can be when there's another diagnosis that hasn't been resolved, particularly migraines. So vestibular migraines can coincide with 3PD. And she talked a lot about, and I would kind of put this in like our soil or our compost part of the cultivation analogy, is having good migraine management in order to be able then to prune the connections in your brain. So another thing that she talked a lot about here was even medication. So medication may provide kind of that systemic piece in the soil. One of the things that Janine said last night that really stuck out to me is some of these medications, really what they do is get the neurotransmitters flowing so that you can relearn and make new connections in the brain. So that was just a really like lovely way to put it in the analogy. And I think that could, I'm not saying everybody needs medication, but for the people that do, that can kind of lay down the soil for you, and help then promote positive neuroplasticity. So, so that's our soil, that's our compost, getting at underlying issues, optimizing our nervous system to make change. Now, here is a really big one, I think, and that is the right amount of water, particularly in dizziness. And there, again, there was so much um, that Janine talked about last night in terms of how we might grade the right amount of water, right amount of sensory input in dizziness. So for a lot of people with dizziness, particularly if it's been going on for a long time, if they have 3PD, there's a lot of visual motion sensitivity. And if you look online, what you see are these like YouTube videos, optokinetic videos of like, watch this to help with your visual sensitivity. And I'm not opposed to videos, by the way. But what Janine talked about, and I've definitely seen this as well, is that those videos that's like water, that's like sensory input into our system. And I've seen that we could overwater. We can even do too many head turns. Um, like our typical kind of vestibular rehab, which typically the more the better. But in 3PD, that might not be the case. And so in those cases, we're actually over watering, and then we're going to kill the plant. We're not going to kill our brain, but we're not going to promote the positive neuroplasticity that we need. So individualizing and providing a very specific dose of your watering, of your input into the central nervous system. I really love that. And one of the things that she talked about with this is ensuring that as you're doing this, you use small doses, long rest periods as needed, and prescribe it in a very exact way according to the person's trigger. So everybody has a little different trigger, so providing it in a very exact way. So that is considering the watering part of our plant analogy for neuroplasticity. So another part of our plant analogy is the weather. So we know this is very important to our plants. Right now we're in a drought in California. This is definitely affecting our plants. And so clouds, rain, sun, all of that's going to affect our neuroplasticity as well. So we can think about our environment, our context, our beliefs, our culture, what our family believes. All of that plays a big role. What I've really noticed is, that the pandemic, that's been a huge part of our environment. There's a lot of isolation from other people. There's less going out into the world. Now, this is getting more and more now, but I've definitely seen this have an impact on dizziness. So you have to take that into account and consider what ways can we modify and change that as well. So we have to consider the environment uh, in dizziness. Now, last but certainly not least is the pruning part of our analogy. I would say this is the most important part for the neuroplasticity. We want to encourage positive nervous system connections. And if there's been some connections that have been made that have gone awry, then we want to help undo those connections. Not an easy task as well. So, one, again, I'm going to go back to some of the things that Janine shared last night about how we might promote these positive connections. And one of the things that she said that really struck me, which is why I'm actually wearing my resilient tank today. And just a little side note, there's an amazing person who had a traumatic brain injury, and her name's Allie, by the way, and I met her online, but she does this art with resilience and did these tanks. I purchased it right away because I love this word, and I don't always feel the most resilient myself. And this is like just a little visual reminder that I am. And one of the words that Janine used last night was resiliency training, training the brain for resiliency. And it was just so beautiful, actually. I thought it was such a lovely word. And part of the pruning is reminding that. And Helena, I just saw her comment. Yes, this is why my patients play so many games with me. Yes. Which, by the way, speaking of games, Janine had some really great ideas as part of our pruning, a couple of brain games to use as distractions. She noted, sometimes when, particularly with dizziness, when we get dizzy, definite high fear response that comes with that. Of course, that comes with that, right? Because we're dizzy and we're off balance. And she noted that it really only takes 2 or 3 seconds of a distraction to help lower that fear response. So she had a couple of recommendations for very simple games. I'll put those in our newsletter this week, actually. That's a good idea. They're phone games, by the way, that can provide some of that grounding to help get through. And when we think of pruning, that's one of the connections we want to decouple, is that fight or flight response, that fear response with the dizziness. And there was something else, I wrote this down, there was something else that she said that was really, again, a really nice way to say it. And it really made me think of the pruning, by the way. She talked about creating a very positive association for the body, for the brain, with visual input. So in a disorder like 3PD, where the visual input has become very overwhelming and created a fear response in a person, when we prune that, so that's a response we want to start undoing and actually start making that visual input be a very positive association. And that's not an easy task, by the way, but she talked through some of the simple steps that you might do in that pruning process, like receiving visual information in small doses, for example, so that it can be tolerated by the brain. And another thing that she said, so one was having that positive association with visual input. A second is again, in a perceptual dizziness like 3PD, not believing the perceptual distortion. And in this case, really, again, in the pruning process, kind of saying your dizziness is lying to you here. It's a perceptual distortion. Not that you're making it up, not that it's in your head, but that your perception, which is a brain connection, is actually not correct. It's it is not in line with the reality. And she actually showed this really great article. I've seen it before, but something about how she presented it last night, actually showing how the within they did a study looking at the perception of vertical in people with chronic dizziness, and they found that in like a black square, in something visually not busy, the person could align vertical. But in a scene of a very busy city, so if you had like city buildings up like this, their perception of vertical went this way. So that perception is off. And the good news is it can be recalibrated. And that's part of that neuroplasticity, that's part of that pruning process that we can do. And boy, so many great ideas that Janine shared last night. And so the one, I know I'm going on for a really long time because I get really excited about this topic, but the one that I did want to share, which again really gets to this pruning aspect, um, is coupling things together. So maybe, you've heard that term, neurons that fire together, wire together. So she couples, and this is what I would say a lot of therapists do working with 3PD, for example, couples a grounding with the sensation of dizziness. So she had a great term for this, which was like applied grounding. So integrating it right away. So this is like so beautiful from a neuroplasticity standpoint, because neuroplasticity is context dependent. So she said, and I agree with this wholeheartedly, like it is not okay to just prescribe a mindfulness application or to do a meditation, or to do, another grounding activity all on its own. What our brain really needs is to couple that with the triggering sensation. So, for example, we might dose an activity that brings on some dizziness, and then we would integrate grounding right in that moment. So this is an applied grounding, an applied mindfulness, applied meditation in that moment. Not separate, although you could really do it, you can do it separate so you have good access to it in the moment. But I know for me, this is a day one, this is what we're doing the most of. And in fact, Janine mentioned this is about half of her treatment, is to start practicing that connection. And basically what you're doing there is pruning those brain connections. You're undoing the aberrant connection and redoing a positive neuroplastic connection. So beautiful. I loved the way Janine shared it. If you ever get the chance to see Janine talk or go to a course with her, you should definitely do it. I have loved it every time. And I'm so thankful that she was able to join our Brain Bites group, which now she will definitely be someone that comes back again. We really just loved it. So anyway, that was a long one today, but in talking about those pieces of cultivating central nervous system connectivity, the soil, the compost, the watering, that input to the nervous system, the pruning that occurs, the weather, the environment, we have to think of all of those with our central nervous system connectivity. So I thank you so much for hanging in there with me today. This is a topic I get so passionate about. And again, join our newsletter. I will put our resources in there for you this week. And then if you want to keep learning and growing with dizziness, we are hosting the Positive Spin on Dizziness course this month, end of this month. It's August 28th. It's a 1 day course. It's online, it's live, and it's recorded. I have been counting down the days to go to this course because it really is a different spin at looking at those components of dizziness. So I'm super excited about that. I'll put a link here in the comments for you. Thanks so much for joining me this early morning today. I'm going to continue to wear my resilient shirt. I hope that you can experience that resilience as well, and that you can help other people, help your patients build the brain resilience um, when they have dizziness and really any other neurologic disorder. It is very possible. Helena, can't wait. Oh my gosh, I can't wait for you to be there as well. So thank you all so much for joining me this morning, and have a wonderful day, a great weekend. I will be camping yet again, the best thing for my nervous system. So I will catch you next week. Thank you.